Stericup and Maxicup are single-use and sterile preparation kits that were exclusively designed by Apothicom to reduce risks related to injection drug use. The Maxicup was developed after the Stericup to meet the needs of some people who require a larger preparation volume. Each Stericup and Maxicup kit contains 3 tools. The cooker is intended for mixing and, if necessary, heating products before their injection. It is a sterile alternative to containers such as tablespoons, which are neither sterile nor intended for this purpose. The cooker is available in 5 colors, which helps prevent the risk of accidental sharing and encourages the personal identification of equipment. It is made of aluminum that diffuses heat quickly and poses no health risk. The handle makes it easy to grasp and heat the cooker without contaminating the content with your fingers, and it makes the cooker even more stable. The cotton filter, made from premium fibers, eliminates insoluble particles which are dangerous to health. Such particles are very often present in injected preparations. Since it is sterile and specially designed for drug filtration, the cotton filter is safer and it retains less of the product than a cigarette filter or a piece of cotton. The dry swab makes it possible to compress the vein and avoid direct contact between blood and fingers. The compression helps to stop bleeding and enhance healing. The Stericup and Maxicup have respective volumes of 2.5 and 5 milliliters. It is recommended to always use the smallest cooker possible. To use the Stericup or Maxicup kit properly, partially remove the paper seal, starting on the side indicated by the arrow. Hold the cooker by the handle without touching the inside with your fingers to keep it sterile. Leave the cotton filter and the dry swab inside the package until you are ready to use them to keep them sterile. To grasp the cooker, hold the sides of the handle between your thumb and index finger. We strongly discourage holding the cooker with your finger under the handle. Once the mixture is prepared, you may heat the cooker using a lighter or candle. While heating, the flame should be positioned opposite the fingers holding the cooker. For standard use, the required heating time is complete when the first bubbles appear. Once the preparation is ready to be filtered, carefully drop the cotton filter directly from the package into the cooker without touching it with your fingers. If necessary, turn the filter with the tip of the needle or syringe. If you are using a syringe with a fixed needle, insert the beveled tip of the needle into the center of either flat side of the filter. If you are using a syringe with no needle, place the tip of the syringe on the rounded part of the filter and press down lightly during filtration to prevent the aspiration of air bubbles. After injection, compress the vein using the dry swab until bleeding stops. After this final step, all the equipment should be discarded. While using sterile single-use equipment does effectively reduce certain risks, other measures are also recommended. Infections, such as abscesses, are often caused by bacteria present on the hands or in the mouth. To prevent them, it is recommended not only to use sterile equipment, but also to wash hands before each injection, to always disinfect the injection site, and to never lick the needle. Sharing your equipment poses a considerable risk of viral transmission, particularly of HIV and hepatitis C. Never sharing your equipment is the only effective way to prevent such risk.